Welcome to Washington Watch with Congressman Walter Jones. Each month, we take a look at the events happening in Washington, D.C. and how they affect our lives here in eastern North Carolina. And now, here's your Congressman, Walter Jones.
Welcome to the October edition of Washington Watch. Today's guest is Congressman Eric Cantor, who has represented Virginia's 7th District since the year 2001. In November 2008, Eric was elected to serve in the congressional leadership as the Republican Whip. Eric holds a seat on the powerful House Ways and Means Committee, which directly oversees taxes, trade, Social Security, Medicare, health care, and welfare reform. He also serves as chairman of the Congressional Task Force on Terrorism and Unconventional Warfare. Eric received his law degree from the College of William & Mary and his master's degree from Columbia University in New York. He is a lifelong resident of Richmond, Virginia, where he and his wife, Diana, are raising 3 children, Evan, Jenna, and Michael. Eric, thank you for being on the show today.
Walter, it's a pleasure to be with you and your viewers and constituents in eastern North Carolina.
Eric, thank you. The very first question is because many of the constituents back in my district, and I'm sure across the United States, really sometimes don't understand the leadership, whether it be Republican or Democrat. So you being the Republican Whip, will you share with the viewers what your responsibilities are? And I mean, you've got a tough job. I'm the first to say that, so let me make that clear.
Well, Walter, you're right. I don't think many people wake up thinking about what a whip is. But the story is told that the word and the term came from an individual that was on horseback during the fox hunt in England years gone back, perhaps in Virginia today. The folks that are really responsible for making sure the hounds stay in formation while they're chasing the fox. The analogy is probably an appropriate one, but Parliament, Westminster in England, actually started the term, and I think originally used the term whipster to connote the activity that one engages in trying to corral the votes necessary to either pass or defeat a piece of legislation on the floor of a legislative body. And as you know, that's what the whip does on the Republican or the Democratic side of the aisle, is they are worried about where members are, trying to understand what members' constituents where they are in a bill, what drives Walter Jones. And I know with you, the concerns of the veteran community are very, very prominent in your daily life in eastern North Carolina. So if I know that, I can work with you and our entire team, and that's how we sort of work together as a whip.
Well, Eric, thank you for that explanation. I want to say to the viewers that as a Republican, and certainly Eric is a Republican, this young man has a very bright future that could be a future leader of our nation. And I don't need for you to respond on that, by the way, Eric, but I mean that sincerely. You have been very outspoken on the spending concerns that you've shown many times on national shows, by the way, about our economy and the health care issue. Since you are on Ways and Means, I wish you would take just a few minutes and explain to the people back in the 3rd District of how the minority party on the 3 committees dealing with health care tried to have input. And if you would share some of your thoughts on that, I'd appreciate it.
Well, Walter, I think your question really hits on so many of the concerns that the families that you represent have, those that I represent have, and really reflect where the nation is right now. People at home at night at their kitchen table are sitting around discussing how they're going to make it through the month, whether their jobs are going to be kept, and whether their children will have the same type of opportunities that they had. And so while they do that, there's a natural sort of belt tightening process that goes on in these tough economic times. So when we approach health care, you know, we really ought to be very focused on trying to do that. As you suggest, the Ways and Means Committee on which I sit did mark up the President's health care bill. It passed the committee without any votes on the Republican side of the aisle, and if I'm correct, 3 on the Democratic side of the aisle voted against the bill as well. The concerns that we have really focus on, I think, much of where the fears are among the American people right now. One, people are very fearful that what Congress does may lead to a situation where the government in Washington interferes with the decision-making between a patient and their doctor. We've got a guarantee against that. Number two, I think that we need to guarantee that never can we be put in a position where the government can deny care based on gender or age or whatever basis. And thirdly, the American people, those in North Carolina, Virginia, and elsewhere, are looking for some sense that we're not going to break the bank in doing this, because it does reflect strongly on our economic opportunity for the future. So that's sort of I think the context in which we are finding ourselves and how we can go forward. If we agree on those prerequisites, I do think there are plenty of areas of agreement that we can focus on.
Eric, thank you for that comment, because I found out during the 30 days we were home during August, and I got into 15 of 17 counties, by the way, and what I found out from the people, they agree, and I'm talking about doctors, I'm talking about hospital administrators, I'm talking about registered nurses, they all agree we need some reforms. But as you said, and said very well, it's the idea of a massive takeover by the government that really excludes and eliminates the thought and the working relationship with the doctors. And I want to thank you again for being so out front on this issue. Let me ask you this, because it's really came up the other day. I was telling some people back in the district that actually it might have been your committee or another committee that the Republicans offered an amendment to say that they would let the American people participate in the same health care that we have.
Right. First of all, as you know, we are participants, or eligible at least, for participation in the Federal Employee Benefits Program. That program does not have a public option. That program essentially contracts with insurance providers in the 50 states from which members come. So your options are in North Carolina and are presented under the regulatory system in your state. Mine are in the neighboring state of Virginia, and the plans that participate under FEBP match the Virginia requirements as well. So I do think that could serve as a starting off point, because where we fall, I think, apart in this discussion of how we go forward, everyone wants to see larger risk pools. Right. Everyone wants to see a much more functioning market for individuals, because when people lose their job currently, North Carolina or elsewhere, most likely they're going to lose their health care. Right. Because in this country we have an employer-based health care delivery system, coverage delivery system. And so we don't have an individual market that functions very well. And even if you do get a quote, in some states like mine require an insurance company to be there as a last resort, they aren't required to offer it at any particular price. So what happens, the person who is on his or her own gets a quote that they can't afford, so they go uninsured. So the way we believe to fix that is to allow people to have a much broader choice of where to go find insurance. And if we were to pull together as North Carolina and Virginia and say, okay, individual markets can form in regions, we should allow for some reciprocity in regulation, or something that our regulators could get together and form a compact so that we have that much more of a risk pool. It would help bring down competition. There are plenty of areas, I believe, that we could pull from in terms of ideas. The FEBP is one. I think the essential notion is, and what the American people want to hear, is we as members of Congress are willing to live under the same rules as they are.
Absolutely.
Now, in the Ways and Means Committee, we proffered that amendment to say, okay, if you think a public option is so good, then all of us should live under it. They rejected that amendment. Right. And so I think that is telling in and of itself that
Absolutely.
Maybe this public option is not the right way to go.
Absolutely. Eric, let me, because I know you've been speaking out about the direction of this nation, and many of us, in both parties to be fair about it, are very concerned about the fact that we continue to be a debtor nation. We continue to borrow more and more money from Chinese, from the UAE, and from Japan. And you being the leader that you are in the Republican Party, where do you think we're going?
Well, Walter, I know you share my concern. This country, in the last 8 years, when we were in charge, we could have done a lot better.
Yeah.
I mean, let's start with that necessary bit of contrition there.
Right.
However, since January, the amount of debt piled on that our children and their children will have to pay is enormous. Some have said that the level of debt incurred over the last 8 months is more than that which has been taken on in 200 years by this country. We've got nearly $10 trillion worth of deficit that we face over the next 10 years. On top of that, we have $56 trillion of unfunded obligations in the Medicare and Social Security system.
56 trillion.
Now, we can't even conceive of those numbers. I mean, they're
Right.
so somebody did some calculation, and they went and took 56 trillion and made some assumptions and came up with an example. That represents, if you spread it out to the population, $483,000 per household of debt owed. So if you think about the level of income for median household income in this country is $48,000. That's 10 times the amount of annual salary that people owe per capita, per family. So essentially it's like having a mortgage 10 times the value of your annual income with no house to show for it. That's where we are. And that's why we've got to really get our act together, stop borrowing money we don't have, because ultimately it will mean much higher taxes and the inability for us to sustain a standard of living that we've become used to in this country.
That is astounding. I heard you some of that information, but you've given me additional information. I hope that in the next 2 or 3 years that we can come together, being in both parties, and just slow this train down. That brings me to a point today. I didn't know about the bill that Brian Barry, Democrat, and Greg Walden, Republican, had co-sponsored, and they asked me to sign a discharge petition, so I got in line with others to sign it, both Republican and Democrat. That I think makes a lot of sense, and I think you've been speaking out about this. Certain bills, particularly those that are very comprehensive, those that are very complicated, that there should be 72 hours before that bill is brought to the floor. Would you speak to this? Because I know you felt this way when we were the majority, by the way, which we didn't do it, but you did speak about this.
Yes, and I think the public saw this during the debate and discussion over the stimulus bill. What happened was that bill came to the floor. Essentially, it was put up online 7, 8, 9 o'clock in the evening the night before, and then voted upon the next morning. There was no way anyone in Washington on Capitol Hill read the entire bill. It was almost inhumanly possible to take it in, understand it, which then yielded the result that we have, which is the nearly $800 billion stimulus bill. Many argue over its efficacy. I feel that it missed its mark because we have a lot of joblessness in this country still, and that was the primary aim of the bill, to stave that off. So what this bill is pretending to do, and you and I will sign on to the discharge petition, is to demand the bill come to the floor. And the bill says that we must have 3 days for bills to lay over before they can be voted upon. And that is, that's for the public too. Let the public have the right to know. And then all of us will be better informed. I do believe it also may help bridging differences so that we can get a better product.
Right. Well, Mr. Whip, I believe, as you do, that this is the time that if America's ever wanted us to find common ground, which we have different philosophical differences, and that will exist, but there are common grounds on many issues that we really do need to come together. And that brings me to the point. Since the August break, have you found the Democratic leadership more willing at all to speak to our leadership, which you were part of?
Yeah, Walter, I wish I could answer that in the affirmative. We have to remember right now, we don't have a divided government. we have a Congress held large majorities by the Democratic Party. The majority has 40 vote advantage in the House, and in the Senate there's 60 votes being held by the Democratic majority, and obviously in the White House is a Democratic president. Right. And what this means is there is not a lot of incentive for the majority and the Speaker of the House to be willing to open her door. And unfortunately, what that has meant is they and Speaker Pelosi has allowed there to be a rush of bills to the floor that are so far outside the mainstream in this country that it's caused people to get upset. And I think you and I both saw it in August with the town hall meetings.
Absolutely.
And we continue to see it because people have this sense that somehow government's trying to take on way too much that we ought to leave up to families, individuals, and businesses to do. And so it's almost as if the pendulum has swung. We are in the area of the extreme, and we need to bring it back. So your, I think, inquiry is a good one. We really ought to be working together. These issues are way too big for one party to be ramming through Congress.
Well, Eric, we have about a minute and a half, and I want to bring one other subject up very quickly, and only have about a minute and 30 seconds, but the issue of the energy bill that passed by 7 votes. Do you think the Senate will take it up, or can the Republicans on the Senate side hold it back?
Well, there I think is a shot that they can hold it back. I think the public needs to get engaged in this issue. This is essentially a cap-and-trade bill that will bring on a national energy tax. If you pay a light bill, if you pay a gas bill, you'll pay more for it. It's essentially Washington telling you what kind of car to drive, what kind of fuel to use, when you can turn on your lights, and to pay for the ability to do all of that. It's not the American way. All of us want to leave a cleaner earth. We really do.
Absolutely.
Democrat and Republican. And so we need to find a way to go forward where we both can agree. I think all of us can agree on the notion that if we are a prosperous country, we'll have the resources necessary to commit to technology, that we can find a cleaner way to reduce the cost of alternative fuels to be competitive with those of fossil fuels. But we've got to get there first, and that means fixing the economy.
Right. Eric, I want to thank you for being on the show today. I think that everybody that's watched this show today can see why I have so much respect for this young man, and I hope one day that he will be a national leader. In just about 10 seconds, Glenn Downs is going to join us to review some of the letters that have been sent to us from back in the district. So if you will, stay with us, and in about 10 seconds, Glenn Downs will be with me. Eric, thank you again for being on the show.
Thank you, Walter, very much.
God bless. Thank you.
Appreciate it.
Thank you. Welcome to the second edition of our October show, and I'm delighted to have Glenn Downs, who joins me once a month for the show to talk about some of the issues that he's heard about from the people back home that maybe I don't know. So, Glenn, glad to have you again.
Thank you very much for having me back again, Congressman. But these are questions you will know, because it turns out most of the things that you and Mr. Cantor discussed are issues that are on the minds of the people in eastern North Carolina. Right. And one that we are hearing an awful lot on is this health care issue. People really concerned about the proposed big changes. And you and Mr. Cantor you discussed some talking with doctors and health care professionals in eastern North Carolina. What can you tell your constituents back home that you're hearing from medical professionals in eastern North Carolina?
Glenn, the medical professionals that we've listened to and talked to and met with are just basically saying that, you know, if we as a nation would just slow the train down, look at what is the biggest issue facing the American people, and I don't know exactly what. Let me just use for an example. Is it's pre-existing conditions, or it's people that are out here working hard, doing the best for the family, but they cannot afford, affordability, whatever it might be, to take it one at a time and fix it one at a time. And after you fix the most difficult problem facing the American people, go to problem number 2. And you know, the new president, he's got 3 more years. We can do these things if we work together. And that's really what I'm hearing back home is people agree we need to reform certain aspects of the healthcare system, but don't try to do it all at one time.
Well, one very specific fear that has been communicated to your office a number of times by a number of different people have been from senior citizens. And they're reading that there are some of the plans that are being proposed to expand this government function of health care being paid for by reducing money that are going to existing Medicare recipients. Is there any truth to that?
Lynn, there is truth to that. We've been able to verify that information, and the staff has. And basically what we're saying right now, if we didn't do one thing, nothing, that Medicare would be bankrupt by 2017. That's just about 7 or 8 years from now. And if that happens and we do nothing to fix it, then nobody gets any assistance. So what many of us would like to do in both parties is to go ahead and try to fix the Medicare system. But your point is right. The House package, I don't know what the Senate package would do, but the House package would actually cost $500 billion to take that away from Medicare, which is in financial trouble. It doesn't make any sense.
Well, you were a few years ago one of the people who voted against expanding Medicare prescription drug benefits, in part because it was spending a lot of additional money, but there was no more additional money coming in the front door to fund the money going out the back door. Is this Medicare chickens coming home to roost, or what is this?
Glenn, that's a great point you just made, and absolutely you're right. That year that we passed the Medicare prescription drug Part D bill, as a reminder to those watching the show, that's the bill they kept open to 6:30 a.m. in the morning to get votes to pass the bill, and I was one of 25 Republicans that voted no. But the bill did pass, and you're exactly right. The cost estimates they gave us before that vote a few years ago was way under the true cost that now you're making reference to, that is costing Medicare a tremendous amount of money.
One last Medicare fear, then I'll get off this, but we have had this communicated to your office, so I think people want to hear an answer. A concern is, aside from the money going into this new program, right now Medicare recipients 65 years and older are having very difficult times getting doctor's appointments. They're saying that they if you don't already have an existing relationship with the doctor says, no, I don't need any more Medicare patients. The rate of reimbursement is too low, and they're concerned that if there's an additional new government program expanded, you'll have even more people competing for those very few doctors who currently will see Medicare patients. What are you hearing from doctors and nurses in eastern North Carolina?
Glenn, they're very upset. The points you made about the reimbursement would be lowered, I think, in my humble opinion, if the House bill passed. I can only speak about the House bill. And many doctors are saying that if the House bill should become the law of the land, many would decide not to practice. We've got a real serious situation, and that's why I think, again, as Eric Cantor said, as you've said, and people back home, let's slow the train down, let's fix it and fix it right. And so that's what we're hoping for.
Time's always short on these shows, but if I can just pivot for a second.
Sure.
People in eastern North Carolina are always concerned about the military and people in the military and their well-being, and we've got an awful lot of wounded warriors coming back, and people how they're going to be taken care of. There are a couple of initiatives you've been involved in down at Camp Lejeune in particular, and then nationally also. But can you just talk a little bit about some of the things that you are trying to work on to make sure that those people coming home who have been wounded in combat will be taken care of and their lives made better?
Well, Glenn, yes, and I want to say to many of the communities where the bases are located, thank you for what you're doing to help the wounded warriors. Glenn, specifically, our bill that is now in conference deals with PTSD.
Which is, what is PTSD?
That is a post-traumatic syndrome that comes from war, actually. And what this bill would do is to allow a soldier, Marine, Airman, whomever, that was had PTSD and were discharged from the military without getting a medical board, then they would be able to go back, if this bill should become law, to the Department of Defense and say, I want to have a review of my medical condition because they did not take into consideration all the facts. So my hope is, and I think we've got a pretty good chance of that staying in the bill that gets to the desk of the President.
Well, to follow up on PTSD and other related syndromes in terms of some of the things that can actually be done to help particular wounded warriors with their particular problems, one thing you've been involved in with is something called hyperbaric oxygen therapy. Can you quickly talk about that? And
Glenn, we have spent 3 or 4 years as an office looking at this. We think it's a program that can help us wounded with TBI and PTSD. And I'm pleased to say that this month of October, there's supposed to be a hyperbaric chamber placed at Camp Lejeune to help our wounded with traumatic brain injury as well as with PTSD. Glenn, I want to thank you. Obviously, we got 40 seconds, and I do want to close, since Glenn brought it up about our wounded veterans. Let's not forget to pray for those in Afghanistan and Iraq, and not forget to pray for the families of those who are in Afghanistan and Iraq. Our military is under a tremendous pressure at this particular time, and we need to pray for them and hope for the best, and maybe someday we can find peace. With that, I think this has been one of our better shows, quite frankly, this October show, and I hope that you feel the same way. That's what's more important than how I feel. And God, please bless our men and women in uniform, and God, please continue to bless America. Thank you for watching our show.
Thank you for taking the time to join us for Washington Watch.